Welcome you bike. Let's go on. Pharmacokinetics. Diazepam, it is the representative drug in this group. It is lymphophilic. Absorption of diazepam is rapid, complete after oral administration. But after absorption, above 95% of diazepam binds to plasma protein. This plasma protein binding rate is also relatively high. And diazepam is metabolized by the hepatic macrosomal metabolizing system, especially the metabolites include diazepam, oxazepam, and temazepam. These metabolites of diazepam are also active. Actually, maybe these active metabolites contribute to the long-acting action of diazepam. Although benzodiazepines, including diazepam, has many advantages than that of barbiturates, they also has many adverse effects. Usually, these adverse effects are related to those related to depression of CNS functions. So, usually, at relatively low dose, these drugs induce drowsiness, cognitive impairment, and diminish the motor skills. So, like for the patients with high, for the patients who work high above the around, or like drivers, pay more attention, try to stop working. Yeah. And when someone administered too much at toxic doses, maybe benzodiazepines induce respiratory and cardiovascular depression. So it is relatively dangerous. Depending on the dosage and the duration of use, tolerance occurs in varying degrees. Some will also induce withdrawal symptoms, especially caused by long-term therapy. These symptoms range from restlessness, anxiety, weakness, orthostatic hypotension, to hyperactive reflexes and generalized seizures. These drugs have inhibitory effects on CNS. Once withdrawn, the neurons of CNS cannot adapt to that conditions. Usually, these symptoms are stimulant effect on the CNS. So that's why these drugs, benzodiazepines, still induce dependence. Once someone administered too much, maybe induce acute poisoning because it may induce fetal respiratory depression. Actually, death rate caused by benzodiazepines is not very high. It can be corrected by these antidotes, specific antidotes, fumazanil. This is a specific antidote for benzodiazepines. Although benzodiazepines are relatively safer, but it's also commonly used. They're also commonly used. They are not necessarily the best choice for anxiety or insomnia. Certain antidepressants with anxiolytic action, such as selective serotonin reuptake inhibitor, are preferred in many cases, and non-benzodiazepine hypnotics and antihistamine may be preferable for insomnia, especially in the treatment of anxiety. Actually, there are some other agents, like antidepressant, paroxetine. This drug usually it is work as the first-line agents in the treatment of chronic anxiety disorders, especially in patients with concerns for addiction or dependence. Buspirone. It is serotonin receptor A partial agonist. It lacks of anticonvulsant and muscle relaxant properties, causes only minimal sedation. So that's why it is also mainly used to treat chronic anxiety. Okay, just now you mainly studied benzodiazepines, and compared with barbiturates, they have more advantages. So especially in the treatment of insomnia, it replaces barbiturates, the classic agents. But maybe you are curious about this. Are the benzodiazepines still available in the clinical practice? Let's go and study barbiturates. Barbiturates are derivatives of barbituric acid. They have been largely replaced by benzodiazepines in the treatment of anxiety and insomnia. But some barbiturates are still used to induce anesthesia and to treat epilepsy. The barbiturates are classified into 4 types according to their duration of action. The pharmacological effects on the therapeutic application of barbiturates. Actually, barbiturates deprive the CNS at all levels, from mild sedation to general anesthesia, in dose-dependent fashion, and overdosage is followed by respiratory depression and dies. These effects are dose-related. Sedation and hypnosis. The barbiturate produces sedation at low dose, while they cause hypnosis at higher doses. Now, most of them have been replaced by benzodiazepines as sedative hypnotic agents. Anticonvulsant and anti-epilepsy. Phenobarbital has potential anticonvulsant and anti-epileptic effects. It is used to treat tonic-clonic seizures and status epilepticus, but it is not the first choice in the treatment of these seizures. Anesthesia and pre-anesthesia application. Sulfitol is used for intravenous anesthesia or inducing anesthesia. Phenobarbital is used in pre-anesthesia. And adjuvant amylbarbital sodium usually used for the animal anesthesia. Compared with benzodiazepines, actually barbiturates has a relatively lower therapeutic index. So with the dose increase, barbiturates also induce anesthesia, even inhibit induce medullary depression, even coma, and dies. And it also has more side effects and more tolerance and dependence. And the rebound also is relatively more than benzodiazepines after withdrawal. And barbiturates also hepatic enzyme inducer. After administration of barbiturates also increase or promote the metabolism of itself and other drugs based on the hepatic enzyme metabolism. And high dose of conventional sedative hypnotics, especially alcohol and barbiturates, can cause depression of medullary neurons, leading to respiratory arrest, hypotension, and cardiovascular collapse. These effects are the cause of death in suicidal overdose. In the past, when barbiturates, actually before the discovery of benzodiazepines, barbiturates were widely used to treat insomnia, and they were the common agents used to suicide. Yeah. Mechanism of action caused by barbiturates is similar to benzodiazepines, but different from that. It also enhances the binding of GABA to GABA receptor, but different from benzodiazepines. Benzodiazepines just increase the frequency of opening of chloride channel. These drugs, barbiturates, just prolong the duration of the chloride channel openings. So the result of chloride ions influx is similar to that of benzodiazepines. Also increase the chloride ions influx, so induce hyperpolarization. It also induces inhibitory effects on CNS. When barbiturates is used at a higher dose, it can reduce glutamate, induce the depolarization, and inhibit voltage-dependent sodium and potassium channels. In sedative hypnotic concentration, barbiturates depress the reticular ascending activating system. Barbiturates also induce more adverse effects. At hypnotic doses, these drugs usually induce drowsiness, fatigue, and dizziness after the patient's awake. I have taught you there is a concept of an adverse effect is residual effects, residual reactions. I gave you an example like this barbiturates. Physical dependence. This drug often induces physical dependence. After using this drug in the treatment of insomnia, abrupt withdrawal causes tremors, anxiety, weakness, restlessness, vomit, seizure, and etc. And this drug also has potential for addiction. And this drug has more potent depression on the CNS than benzodiazepines. When it used in relatively high dose, the result, it always can induce death. And usually, there is no specific barbiturate antagonist. So, try not to use this drug at very high dose. Once someone is suffering from this barbiturate poisoning, usually hemodialysis may be necessary if large quantities of barbiturates have been taken. And because barbiturates are acidic drugs, so alkalization of the urine often help in the elimination of them. Remember that? When I teach you simple different ion trapping, I also give you that as an example. For the acidic drugs, alkalization of urine is helpful to promote the elimination of the toxic agents. Other hypnotic agents. Zolpidem. It is one of often preferred hypnotics, but it is non-benzodiazepine, and it has no anticonvulsant and muscle relaxant properties. It also has fewer visual effects and little tolerance. Chlorohydrate. This drug also is one hypnotic agent, but it has a relatively narrow safety margin. It is irritating to the gastrointestinal tract, and chlorohydrate was previously a popular hypnotic for children because it can administer rectally. For children or the elderly people, maybe it also can be used, but actually nowadays it has very limited use. Okay, that's for this chapter. I also give you 2 questions to help you to review this knowledge, this content of this chapter. The first question is more important. Try to state briefly the pharmacological effects and clinical uses of benzodiazepines. Yeah, you should know well the representative agents of benzodiazepines is diazepam. Remember this. And what are the differences between benzodiazepines and barbiturates? What are their mechanisms of their inhibitory effect on seeing eyes? And what are the difference between the pharmacological effects and the clinical uses of them? Okay, that's all for this chapter. Thank you. And this table, some terms related to sedative and hypnotics. You can study by yourself. Okay, see you next chapter.